Minimally invasive doesn't mean anything. And, minimally invasive was a term that probably some marketing people came up with, and I think to the patient, it means a smaller skin incision. What the patient doesn't realize is if the surgeon is making a smaller incision in order to make your scar prettier, but if that incision threatens your ultimate outcome, it ain't worth it, right? But patients don't see that. We always talk about the incision, that it's the only thing the patients see. So all the real work happens below the incision. Of course, we all know that intellectually, but again, it is absolutely true. The incision is the only thing they see. So what does minimally invasive mean? It means absolutely nothing. To most people, it means a shorter incision. But to a surgeon, what I'm most focused on is how am I less invasive? There's this great podcast that I've heard about called Less Invasive. How do we make it less invasive on the patient? Now you've done something. So, minimally invasive, I'm not sure what that means. Knee replacement or hip replacement, no matter how it's done, you're cutting bone and you're putting metal inside a human body. Like you can only make that uh, so minimally invasive, if you will. But you can actually you can absolutely make it less invasive, softer on the soft tissues, etc. So the things that you're seeing on YouTube now, you can get YouTube and Instagram and all that. Anybody can watch surgery now, but you're seeing larger incisions, and oftentimes we do a larger incision to demonstrate them for the video. Like that, that's the truth of it because we want you to be able to see what we're doing. But the skin incision length honestly has no impact on the patient's recovery, but they're worried about it and they're concerned, and it needs to be acknowledged. I'm not trying to make huge incisions on anybody, but it's far less important than what we do below the skin. So robotics, which you mentioned, this is all about what we do below the skin, right? The robotic arm, at least in orthopedics, doesn't make the incision. That's still the surgeon. But it's all about what we do below. How do we handle the soft tissues, the ligaments? In knee replacement, we save the MCL and LCL for sure, and oftentimes we'll now save the PCL. How do we treat those tissues during surgery? How do we cut the bone? Are we cutting it 3 times, and does the saw go beyond the edge of the bone, or are we cutting it once and that saw blade stops at the edge of the bone, therefore only violating the tissue that it needs to violate? That's powerful. And so even though you might be seeing larger incisions and the patient might be focused on the incision, it's not that we shouldn't care about that, but that is far less important to the patient's recovery and honestly to me as the surgeon. How are we going to treat the soft tissues below the skin better and with precision? And that's the promise of robotics.